Okay, hi guys. Welcome to our webinar on pet cancer awareness. As you know, November is Pet Cancer Awareness Month. So we have vet tech Amarpreet with us, who's also a vet from back home. And we have Ajay, who is an aspiring vet technician, right? Or wanting to become a vet, right? Yeah. So I'm gonna let you guys introduce yourselves and I'm gonna give you the stage. We are recording this session, so whoever missed it, we will put it up on Instagram. We might have to, do it in two separate sessions just because Instagram only allows like about 15 minutes or so of a session. Okay, so Ajay, we're gonna begin with you.
All right. Yeah, there's not much to me. You pretty much mentioned it. I'm an aspiring vet, so I'm currently doing my undergrad at York University. But yeah, so let me see if I can figure out how to get this thing to share. All right, can everyone see my screen?
Yep.
Can you see my screen, Navjot?
Yeah, I can.
Okay, perfect.
Yeah.
All right, so I want to talk to everyone today about pet cancer awareness and screening. As a group, we all need to become more aware and vigilant about cancer because it's a natural tendency for us to avoid things that we fear, and certainly cancer is one of them because there's a lot of negative connotations associated with it, such as pain, suffering, poor quality of life. So we can all agree that cancer is a terrible disease. However, when it comes to our pets, we do a disservice to them when we ignore it. It's best to tackle this type of situation head on because there's actually benefits for both the owner and the doctors when they acquire basic knowledge well before the time when a pet could develop cancer. And so by doing this, we can actually empower ourselves to make appropriate decisions if our pets are in the unfortunate circumstance where they can get diagnosed with cancer. We can also potentially do something to work proactively. We can try and reduce the risk of cancer as well as take our pets for annual checkups. So that way they can get an early start if they do get diagnosed with cancer, because early detection is probably one of the biggest factors that play into survival rate. And so when we talk about incidences of cancer, we know that there's roughly 170 million pets in the US. I tried to find some Canadian stats, but you can't really find much, so we're just going to use US today. And then, yeah, so there's staggering numbers of about 4 million dogs and 4 million cats are diagnosed with cancer each year. We know that about 50% of dogs over the age of 10 will develop cancer, and that 25% of dogs at any age can develop cancer in their life. So that's extremely high. We know that's higher than in people. Yet in people, we know that many engage in a lot of negative activities to enhance this behavior, such as smoking, poor diet, chewing tobacco and stuff like that. Yet there's still a higher percentage of animals that get cancer, so this is pretty concerning. In cats, we know that the number is lower. It's hard to find specific stats because most people, when they do research, they focus more on dogs, to be honest. But we know that roughly 1 in every 5 cats, which is about 20%, will get cancer throughout their lifetime. That's at any age. It is less than dogs, but the cancer that they do get tends to be a lot more aggressive. So studies haven't really determined how much incidence of cancer is changing over the past 2 decades. The numbers are definitely higher than before, but it's unclear as to whether more animals are actually getting cancer or if it's just because primary doctors are doing a better job at diagnosing it, or if people are becoming more aware of cancer, and so they're taking their animals a lot sooner to get them checked out and doing a lot more screening. And so this brings us to the question of why is cancer increasing? So most people try and relate their animal getting cancer to one specific scenario. So say they get their grass-fed pesticide, they'll blame it on that one thing. But the reality is that it's multifactorial. It really honestly depends on 3 major factors, which are age, genetics, and then environmental factors. So age is definitely a major factor when it comes to cancer. There's no doubt about it. Animals get older and the chances of them developing cancer increases as well. As we think about cancer, it arises when one of the normal cells in the body undergoes mutation and it becomes abnormal. These abnormal cells then have the potential to divide uncontrollably and then take over their host, which would be the cat or dog. We know that the longer that you live, the greater the likelihood is that something can go wrong. So this might be one of the reasons why we're actually seeing more cases of cancer, because we know that the care of animals has increased significantly in the past 2 decades. And so this improved care of animals has resulted in an increased longevity of pets. And so the longer they live, the greater the likelihood is that they can develop it. And then, so genetics. We know that there's a clear and probably even more so in animals than in people significant genetic component to developing cancer. We know that genetic predispositions is one of the major influences of certain types of cancers in people. For example, someone who carries a certain gene might have a higher chance of getting breast cancer. And the same is likely true in pets as well. So the way that we think about genetics in pets and the influence of genetics is that we know given breeds of dogs, we know certain breeds are more predisposed to certain types of cancers. Virtually every type of cancer in pets has a greater prevalence in one type of breed than another due to their unique genetic makeup. So when you look at the Bernese Mountain Dog, we can say that approximately 40 to 50% of them will develop cancer over their lifetime. And then same goes for the Golden Retriever, except it is higher at 60%. And then when you look at boxers, we know that they have the tendency of, if they develop cancer, to develop brain tumors, mast cell tumors, and lymphoma. Same with the Scottish Terrier, they are predisposed to developing bladder cancer. There's definitely not as much information on cats because cats are, for the most part, mixed breeds. But purebreds like the Bengal cat, they have a tendency to develop lymphoma. And then the Siamese have, well, they just have an abundance of types of cancer, such as salivary gland, mast cell tumors, and so on. And then external factors. So for me, this is one of the most concerning factors because it's likely a major factor to play in the development of cancer in pets. When we look at humans, we know that we do things like smoke, we have poor diets, we chew tobacco, etc. This can cause an increase in cancer. So when somebody comes back saying, yeah, like I've got mouth cancer, lung cancer, we know that, okay, there's something that you could have done that could have caused this for you. But what's worrisome is that animals don't engage in this type of activities, yet there's still an epidemic level of pets which are developing it. This must mean that there's a significant amount of toxins in the environment, which these animals are getting exposed to, which means that we're getting exposed to them as well. And so there's not many studies which really link one specific exposure of a single chemical to animals developing cancer. And realistically, they never will be. This is because it's a multifactorial thing. So you'll never find one chemical that leads to a specific type of cancer. It's the abundance of exposure that can cause it. And so what do we know in regards to environmental factors and cancer? In regards to secondhand smoking, like people that smoke in their households, we know that cats that live in the households where smokers, or where there are smokers, are at an increased risk of developing oral squamous cell carcinomas. And so basically what happens is, as the owner's smoking around the house, the smoke will get on their fur, and we all know cats don't really bathe often. They lick themselves clean, and so this can cause cancer to develop under the tongue. And then in a similar scenario for dogs who live in a household with a smoker, they're at an increased risk of developing nasal passage tumors. This is because the nose of a dog is a lot longer than that of a human, and so their nose actually acts as a filter. So as they're breathing in that smoke, it causes them to filter out the tobacco and everything like that, which causes it to get absorbed by the nasal passages and essentially develop cancer. And then there's also dogs that have lived in more industrial areas. These dogs are exposed to industrial solvents, and they are at an increased risk of lymphoma. Similarly, in human medicine, there's also a link between the exposure of these industrial chemicals and the possibility of developing lymphoma. And then specifically with a product called Roundup, that has been majorly linked to causing lymphoma in a lot of people using their backyards and in their houses. So that's potentially why their animals are developing it. There's also been some studies that show dogs exposed to pesticides and herbicides seem to be at an increased risk of bladder cancer. The reason for this is because once it's sprayed on the grass, dogs eat grass, they lick everything. They can ingest the chemicals, which is then filtered out by the kidneys and it goes to the bladder. Female dogs specifically, they hold their urine for long periods of time. And so the carcinogens can be in direct contact with the wall of the bladder for extended periods of time, which results in bladder cancer. And so this is the information that we know, but my take on this is that we're all exposed to thousands of chemicals each day because nothing in this world is really real anymore. Everything's made of plastic. Wood is barely even real wood anymore. People ingest tens of thousands of microplastics just from drinking a water bottle. And so we know that pesticides, herbicides, and other chemicals are pervasive in our environment. And so it's believed that the exposure to these chemicals can cause an increased risk of cancer. But the question is that if we're both humans and animals exposed to these high levels of pesticides, herbicides, industrial chemicals, and just other chemicals in general, why are we not developing cancer at the same rate in animals, and why are they developing at an epidemic level? Well, the reason for this is that humans brush their teeth, we wash our hands, we bathe daily, we wash our clothes. So everything that we come into contact with essentially washes off. This doesn't happen in pets because most people don't brush their animals' teeth, myself included. We can't bathe them every day because it's bad for their skin coat. It can also ruin their skin. And so these chemicals stay on their body, and this is where they can get ingested. In the last 2 decades, there's been an increased number of dogs with mouth tumors and nasal cavity tumors, as well as cats with oral cells carcinoma. This is from animals that live in a household with no smokers. So this just validates the fact that there is something in the environment which is causing these increased cancer with like the increased cancer data. And so in regards to prevention, how can we actually prevent cancer? Cancer prevention and like information is not very common, it's lacking.
Ajay, you are muted.
Can you guys hear me? Okay. So yeah, as I was saying, cancer prevention information in animals is lacking. And so in humans, you can say eat better, exercise, stop smoking, don't chew tobacco and all that stuff, and that will lower your risk of cancer. But what can we say for animals that don't engage in any of this behavior? So we know that age is definitely a factor. Well, we can't really do much about that. It's not like we're going to put down animals before they have the potential to develop this. We spoke about breeds, so maybe stop owning certain breeds predisposed to cancer, like golden retrievers or Burmese mountain dogs. Well, that's realistically not going to happen. People love their certain breeds and their certain animals, and I can highly doubt that nobody's going to get rid of them. So something that we can do is to stop breeding of certain lines known to be predisposed with cancer and use alternate lines from that specific breed to create offspring. And then the following point's a little bit harder to do, but you can try and reduce the exposure of chemicals such as different plastics and pesticides in your own backyard. So, I mean, if you take your dog for a walk, you can't really control what your neighbors put on their grass, but you can be sure of what you have in your own environment. And then, of course, one of the big topics is in regards to spay and neuters. There is some conflicting evidence in regards to it. There's been evidence showing that if you spay a female dog before her first heat, then that decreases the chance of them developing mammary cancer significantly. Yeah, but however, if you wait until after the second heat cycle, there's a 28% or 28 times more likelihood of them developing cancer. And so there's definitely an advantage to spaying them at a younger age. However, there's also conflicting evidence because spaying too early in certain types of breeds has been shown to increase the chances of osteosarcoma, which is a bone cancer. And so, frankly, we really don't know yet what the right answer is. It's basically up to the owner, whatever they feel is best. And so diagnosis, with the rare exception, blood work it really doesn't tell much in regards to cancer. You can't use it to diagnose cancer unless it's something like leukemia. But it's definitely a great start. The feel or look of a tumor may also affect our suspicions, but you can't 100% just diagnose a tumor by the way it feels or the way that it looks. The only way that you can 100% diagnose a cancer is by taking a sample of it. And so this can be done via fine needle aspirate, which doesn't always give an answer, but if it's something that a doctor suspects is a lipoma, that's a great thing to use because lipomas always, well, not always, but for the majority of the time, they do come up on a slide from fine needle aspirate. Another thing that you can do is take a biopsy. A biopsy is able to provide more information, such as whether the cell is malignant or if it's benign and how to address the mass. But I'm sure if you're in the veterinary field, you've heard many clients say that they're worried about taking samples because they're afraid that if you poke the cancer with a needle or a biopsy, it might aggravate the cancer, it might cause it to spread or get angry. It is possible, but the likelihood of that happening is extremely, extremely low. And the information that you're going to find out by getting the fine needle aspirate or the biopsy significantly outweighs the chances of the animal having cancer that spread. And so on to staging. Once a pet has been diagnosed with malignant cancer, there's some information that we need to know. How aggressive is it? How invasive is it? Has it spread? And then this information will help determine different prognoses and different treatment options that we can take. And so staging, most people start off with blood work. It tells very little about the cancer, but it does provide an overall health status for the patient. It allows us to know if we can proceed with surgery and determine concurrent diseases. The following thing that most clients do is take a chest x-ray. And so this looks for evidence of cancer spread. The lungs are one of the most common places where the cancer does spread if it is. And then a following thing that we can do is an ultrasound. So this looks for evidence of cancer in the abdomen. X-rays aren't good at looking in the abdomen. You can't really see much of like the kidney, spleen, liver, and all that stuff. And then it also helps to see if there's any other diseases that they may have as well. And then lastly, people can also get CT scans for their animals. This is a 3-dimensional X-ray. It basically shows everything in much greater detail and pinpoints where the cancer exactly is in the body. And it does allow us to have a more thorough plan for their treatment. And then for most clients, discussion of treatment conjures up images of pain, suffering, poor quality due to what they see in like movies with humans and stuff. But the parallels between pets and humans can only really go so far. Most oncologists cannot and will not be as aggressive with treatments as our human counterparts. Instead, they have a very thorough discussion and evaluation of the pros and cons of a treatment, taking into account the animal's age, life stage, their overall health, concurrent diseases or illnesses, goals of the pet family, expected outcomes, and quality of life. And then one of the major factors that they have to take into account is finances, because a lot of people don't have insurance on their animals. So it adds up very quickly. But yeah, the major job of the oncologist is actually to educate the patient on different options they have and let them decide what they want to do from there on. One of the most common treatments for cancer in animals is chemotherapy. Chemotherapy is basically the administration of a drug into the body that can fight cancer. It's either administered via IV or orally, and it can be used to treat cancer that is spread systemically. If it's not spread systemically, then it's not really a good option. There's no point in treating the whole body if the cancer is localized to one certain area. It doesn't hurt. but it may cause nausea or vomiting at a rate of 15% in animals. One of the more common techniques, and to be honest, a more effective technique, is radiation therapy. And so this is the administration of target X-rays to one part of the body. Other parts of the body aren't infected because they're not exposed. And so there's no systemic illness or vomiting. Unlike in people, though, we don't give nearly as high as doses in animals. And this is because we're not essentially trying to obliterate the cancer. We're just trying to shrink it down to give the animal a better quality of life. And then there's also supplemental therapies, such as CBD, turkey tail mushrooms, turmeric, and immunity supplements. There's lots of anecdotes saying that they may work, but there's really no studies to back any of it up. So the majority of this stuff is safe to give to your animal should you find yourself in this situation, but there's no hardcore evidence saying that it will treat the cancer or prevent it. And so to conclude, cancer in pets has reached an epidemic proportion, and we can combat this disease by reducing exposure to different chemicals. So like I said, not spraying pesticides or having foreign objects in your backyard. Early detection, so going for an annual checkup or biannual checkup, that's probably your best bet, because the more frequent you go, the more blood work you may do or the more diagnostics, the sooner you're able to catch this disease, and the higher likelihood there is of a survival rate. And then should your pet fall ill with cancer, then you can use modern therapy such as chemotherapy, the x-rays, and then if you want, you could also try the supplements as well. But our main focus for animals isn't to obliterate the cancer. It's always to keep in mind their quality of life, because we want the best interest for those animals. Yeah, so I will pass it off to Amarpreet.
Thank you so much, Ajay. Let me know if you are able to see my screen clearly. Is it visible?
Yeah.
Okay. Thank you so much for Ajay. It was really informative. And definitely, I agree with you on the line that prevention is something that is lacking when it comes to talking about cancer. And this is most cliched quote, prevention is better than cure, but practically nothing much is done. The emphasis totally on treatment and cure. I will be particularly discussing about CTVT, that is canine transmissible venereal tumor, that is very commonly found in many countries. It's said to be endemic. And before I start my discussion, I would say what is my intention today is to education, that is awareness through education. And our target for today was to educate the pet owners, animal lovers, and other conscious beings, encourage veterinary professionals and animal health workers to spread further awareness, irrespective of where they are located. For veterinarians and people around, see around yourself, and there are many waiting to be helped. My research material that I'm presenting is from BMC Veterinary Research. And before I dive into the research article, I recently learned a very integral information during my psychology courses about what is the purpose of research. And the vital and the integral purpose of research is to generate knowledge. And in the clinical environment, it provides more than one perspective to be utilized in the practice. So it varies case by case. I'm not sharing any images today because I wasn't sure about what audience we will be having. So you can search CTVT and find more visual aspects of that. So starting with CTVT, the nature is that it's a malignant tumor. It's a contagious cancer that is naturally transmitted between dogs by allogenic, that is through cell. direct contact, transfer of living cancer cells during coitus, mating or intercourse, you can say. It is predominantly via coitus, but it has been seen or reported being spread through licking, biting, and sniffing as well. So external genitalia is the main areas that is affected. And in females, it will be area around the vagina, and even the whole, it can extend towards uterus as well. Whereas for male, penis is the main area organ where it is situated. So BMC Veterinary Research in 2014, they analyzed historical literature and prevalence information from 645 veterinarians and animal health workers in 109 countries. From the data, they reported that CTVT has been endemic in at least 90 countries. And here comes a prevention reminder, because anything that is endemic, and when we are talking about something that is malignant or contagious, it can turn from endemic to a pandemic as well. So for example, people who are rescuing dogs from all around, and Navjot is also involved, and a lot of people who are involved, we have to be very pro about it, because a lot of time in a public health view, it is ignored. And not only we are putting other dogs at threat, but we are also raising a stigma if we are introducing stray dogs from different countries. So we have to be just careful regarding that. And often when we use the term malignant, the tumors or the cancer, the property is called as metastasis. That is, it spreads very fast. In case of all the reports that this research has reported, around 0 to 5% of the cases presented in the research article, they reported that it metastasized to the other organs. So if you can see the diagram, the circle represents the primary tumor, that is the external genitalia. And the secondary organs most often found were lymph nodes, nasal cavity, skin, and oral cavity. So if you talk about nasal cavity, it could be sniffing. Oral cavity, again, licking and sniffing, and skin is direct contact. So I will straight away not going into much about treatment, because there's only one drug that is particularly used, that is vincristine, and it is given intravenous. And the treatment depends upon generally 1 to 3 treatments a week apart is enough for the tumor to go away. The best part of this idea is that it is curable, provided we have diagnosed it early and we have not exposed or just lay down the dog to metastasis. So talking about intervention, so early intervention will fuel prevention here. Prevention is the primary intervention. So national developmental status and dog management policies play a very important role in this subject. And then followed by right choice of treatment for the affected animals. Furthermore, if we talk about treatment availability, it is easier for pet owners to get the treatment, but for the stray dogs, that is where the work has to be done. So the treatment is not available and they become the reservoir for transmission. And here again, a stigma another arises, is that stray dogs are the carriers of all kinds of diseases, but they are not, because for CTVT, it has been known to be present in the environment for 1,000 years now. And the exact nature is unknown, because it is the somatic cells that are causing the tumor. So therefore, we are emphasizing more on prevention. For stray animals, prevention becomes the treatment of choice. And that will be neutering and spaying. I will give an example of one country, United Kingdom. The UK, they unintentionally, they introduced dog management policies, and they saw that CTVT started getting declined. So my mother recently, she shared an incident about a female stray dog who they observed that she had tumor on her vaginal area. The delayed treatment was because they were not able to capture her on time. So that is another struggle for spay and neuter organizations or NGOs who are just equipped for spaying and neutering, and they don't have enough resources to help with if they detect a stray animal who's suffering from it. So the challenges here comes that the inevitable are restraining and capturing, no proper infrastructure for carrying out treatments and aftercare, and lack of drug availability. So when we talk about infrastructure here is that we don't know how much treatment a particular dog being affected will require. It could be, they can be helpful in like 1 treatment or 2 treatments or 3 treatments, but also we have less information about the side effect of the drug. So aftercare here generally get compensated if we are dealing with stray dogs. This is the chart I'm showing. Just going to zoom it on here. So if you can see that the arrow shows when the dog policies were introduced, they started spaying and neutering the dogs. That led to the decline, particularly disappearance of the CTVT cases in UK. And if you see the circles that are black outline, but these are the ones they get cases that are imported. So that is what I was talking about, is you have to be very particular when we are inviting other stray dogs or rescue dogs. We have to be mindful about that. It could be that we quarantine or we isolate them for particular 2 weeks to see how they are doing and get them examined, and don't let them interact with other dogs until we get a yes or good to go for after the examination from a doctor. Now I'm talking about behavior intervention. It is not about dogs now, it's about humans. Next time, if you see a case of CTVT, if there's a veterinary professional, same as me, it is important to report, cure, and prevent. These are the 3 principles you should follow. Report, cure, and prevent. For report, I'm telling you is because I have seen negligence in terms of doctors that they do see cases on a daily basis and it is not reported to public health. So hence, if they are not reported, that means that we are ignoring the fact that they exist, and that further leads to spread of the disease. And for pet owners and the conscious beings, if you see a stray animal who is having this, or you detected a tumor, its tumor is like a cauliflower shape, that is a cardinal shape of the tumor. And you will generally see, I mentioned, in external genitalia, either on the penis or around the vaginal area. So you avoid the contact of a companion animal with the affected animal, and be generous enough to extend your help to the animal in need as well. So saving your companion animal or the pet you own will not lead to the prevention or spread of the tumor. It's again in the environment, and it can come back to your companion animal as well. So that is all particularly for CTVT, and certain questions that I thought about were that what are other treatment options in terms of overall cancer, as Ajay discussed, that prevention is lacking. When we talk about cancer, we talk about uncertainty, we talk about risks, and right now with COVID situation, we are particularly dealing with this uncertainty, and that's kind of like a cancer. So when we talk about uncertainty, that if it has already happened, how we take decision is depending upon the quality of life and the vital signs when the animal is presented to the doctor. And then it depends upon the staging, as you mentioned earlier, in what stage the animal is on. And it's very crucial because the communication between the doctor and the pet owner can either go into more gratitude and generous terms, or it can get heated up because we sometimes are not aware that the stage, if we diagnose the animal as final stage, the doctor has nothing to deal with it. The only criteria or the presence the doctor can grant you is help in pain management, and also give all the best options for treatment and cure. So we have to be generous and kind towards each other when this situation arises. So what are the side effects of the treatment? So we only know that vincristine is the only drug that is present, and it is given only intravenously. because if you inject in any other route, it can actually literally burn the skin. That is a very aggressive side effect of incretin. So only intravenous. And are there any route of drug administration, different route of drug administration, for example, oral medication instead of intravenous, that can actually help stray dogs, because not everyone will be able to capture them because of the population right now we are dealing with. And for the doctors or other health professionals, ask these questions to the companies that are coming to you for drug sales or promotion. Then what are they doing in terms of providing other beneficial methods of medication? Because they are like the intermediate where they can carry your message to actual managers or the professional that are dealing with drug production. So we as doctors or health professionals have power to contribute in that what other options we have. The other topic I would say is alternative medicine. In terms of prevention, we generally, the alternative medicine and humans are quite developed. So also in animals as well, I was searching upon CIVT is a website where you can find all kind of alternative medicine branches, acupuncture, holistic approaches to medications, where they talk about prevention. So the website is all about prevention, and I'm pro prevention as well. So I would encourage you to go to CIVT website and see what options that resonate with you in terms of if somebody is going through this situation. And that's pretty much it. Inder, I know you were particularly mentioning about this tumor when you asked. Any questions regarding it I can help with?
Sorry, I had to unmute myself. No,
Yeah.
you answered most of them. It was about prevention. What can we do? And the fact that it's either two treatments or three treatments sometimes.
Yeah.
In the case of stray dogs, we usually deal with a situation where I don't know if that's a side effect. It's more of a chemo or drug thing that the dog stops eating after we give them the first treatment.
Yeah.
And it's so difficult to get it back. So it's as emaciation that happens if it's 3 treatments. They get substantially emaciated.
Yeah.
And it's just getting them back on that diet and getting them healthy. Leaving them on the street and doing this, it's a challenge in itself.
Yeah, it's challenging because that's where the aftercare comes in, because we don't know how the bodies are going to react once we inject the drug. So yeah, the emaciation, the loss of appetite, they're kind of inevitable. Majority of them, when I was in India, we saw that stray dogs, the best positive part of them is that they're quite resistant. Their willpower is like very strong. So most of the cases they recover like in 1 or 2 doses of incretin. Again, it falls to actually diagnosing it, actually detecting it early, and then capturing them to be able to help them do that. But spaying and neutering, I would say, is amazing work to just completely just get rid of it. But having said that, spaying and neutering, we have to be very mindful about our companion animals, because even sniffing, just direct contact with the tumor can also cause that. So if your dog is spayed or neutered, doesn't mean that it won't get the tumor. It's again getting from direct contact as well.
Okay, cool. Thank you.
You're welcome. Yep, I guess I'm just going to end this as a message of consciousness from my side today. It's not related to cancer, it's about consciousness. Next time you are taking a companion animal for a walk, be conscious of them. That is their time to explore the wilderness and be with nature. Respecting their presence on earth is very important for everybody and for humans involved in recreational or other related activities. Ajay was mentioning about environmental factors that promote in causing cancer. For example, the pesticides, if they lick from the grass, sniffing and licking is a part of their nervous system. That is how they perceive. So we can avoid it to some extent, but we be very mindful when you're taking your dog out for a walk. Same case is that if you're littering around with bones or in any other recreational drugs, for example, cannabis is one of the most prevalent cases, the toxicity we see in our clinics. The concentration at which it will cause problem, it's still like they are researching about it. So it's better it's better to avoid it rather than being sorry afterwards. So be thoughtful not to throw used products in the environment and use it safely around, since it's legalized in Canada, use it very safely around your fur babies next time. That's it for me today. Any questions, please do ask. And thank you so much for your presence today, everyone.
So I just have a quick question. What about vaping and
so I mean,
smoking?
information that he provided, Ajay, the vapors itself, if inhaled by dogs, can cause some side effects. So generally symptoms, when you see symptoms like dogs shaking or it's literally stoned as in humans, that means the dog has already absorbed the drug. Like the body's already started absorbing it and it's showing its effect. So it's still uncertainty. That's why we're saying avoid it, because we don't want to see the results. We just want to avoid it. So even tobacco, when you smoke and you throw the out, if they eat it, it's going to cause an effect for sure. So that's something we see every day, or once or twice we see. Cannabis is like the most frequent one we see that happens. And for particularly small breeds, it could be very lethal as well because of their small sizes.
Also, I just wanted to mention that I know that some people have to make the hard decision of putting their pets down when they're terminal. I know that I had read a research article that vets encourage people to stay with their pets when they're going through that transition because they're already terrified. Because a lot of people tend to leave the pet at the vet and then come back to collect ashes or when the pet is gone. But in those last moments, the pet actually looks for their owners. So it's very stressful for them. They almost feel abandoned. So I would request everybody that if you do have pets and they are at that stage where they're terminal and they need to be put down, that please be by your pet's side. I know it's hard for you, but imagine how hard it must be for that pet to not know what's happening with them. And maybe they know they're dying, right? Maybe it's their last time and they don't want anything more than just to be by their human side, right? So that's just something that I had read online, and it was an article. You guys can add more to that if you like.
Yeah, generally on doctor's side, I know it is difficult for the owner, but sometimes they avoid doing that because they think that the dog is going to be in pain, but it's completely opposite. Every doctor who's going to go ahead with the euthanasia, they do give pain medication or a little sedation before they proceed. And while they inject the drug for euthanasia, it takes few seconds, and it's like the most humane method of euthanasia we use. So we give the pain medication, sedation, and then we go ahead with the drug. That takes few seconds for the dog or your companion animal to just leave without any pain. So if that's what causing you to not stay with your animal, I would say it's the most comfortable place to be because it's already taken care by a doctor.
Before we end our session, does anybody else have any questions for Ajay and Amarpreet?
I do actually. So I know there was mention that so there's tumors and masses that would be indications of cancer. Is there any other maybe early signs and symptoms that we should be looking out for in our pets?
Yeah, so I mean, masses, especially those that are growing, are probably one of the most common ones that you can find. But another thing that you can look for are lesions that won't heal even after undergoing treatment, difficulty defecating or urinating, ongoing vomiting or diarrhea, loss of appetite, weight loss, struggling to eat or swallow, lethargy, unwilling to move or exercise. What else is there? I guess like a bad breath from the smell would indicate a tumor. Difficulty breathing or stiffness or lameness as well.
Okay, thank you.
Hi, everyone. This is Riti. I have a question as well. So I have a 7-year-old Old English Bulldog. For the past year and a half or two, I've noticed these lumps or 1 or 2 lumps on his belly. They're very soft and they move around. So I did a little bit of reading up on it. It seems like they could be fat deposits of build up over time. My question is, do these ever turn into, can they ever be cancerous?
I mean,
so what you're most likely referring to is a lipoma. Basically what that is it is a fat deposit. The majority of them do stay benign. They will constantly, well, not constantly, but they do for the most part grow in size. So that is worrisome to owners. But yeah, for the most part, they do remain benign. But your best bet would be to go to your vet clinic and get a fine needle aspirate. What they basically do is they take a really, really small needle, they poke it, they'll suck back on the plunger a couple times, and then they'll squirt it onto a slide. Basically what they can see is is it fat or is there any cancerous cells in it? And then that'll tell you how to proceed. If you notice that it does grow as well, then it is ideal to get it off while it's smaller. But if you notice that it's not growing at all and it is lipoma, I mean, it could definitely stay as well.
Okay, so is it just like a simple procedure, like an incision, where they would just take it out, or is it like he has to go under GA and then, because GA always scares me when it comes to dogs and especially bulldogs?
So it depends. I know bulldogs, they are brachycephalic, so they do have that smushed in face. So it is more worrisome to put them under general anesthetic. So I do get that. Depending on how big the lump is, if it's well attached to the skin or not, if it's, how do I explain? If it's more like a kind of skin tag structure, so at the base where it connects to the skin, if it's very loose, then they could probably use a local anesthetic. But it's honestly hard to say without seeing or feeling it.
Yeah, in his case, it sounds like it's the latter, like it's pretty loose. And you can like touch it and feel it, and it hasn't grown in size. And I've been observing it for a little over a year now. It's very soft, like I touch it and it just moves around. It doesn't seem to bother him, but it is bothering me because I'm worried, what if it turns cancerous at some point? But if it doesn't, and I just have to observe, then that makes my life a bit simpler.
So what I always say is with lumps is, you could always observe it, I guess, over like the next couple of weeks to a month or so, just to see if it does grow in size, because that's an indication that it might be something more serious. But even if it doesn't grow, it's always best to get it checked out, just because something that may appear to be a lipoma might be something else, right?
Okay, that sounds good. I needed that final sort of push. Thank you.
Any other question, guys? I think Prati has a comment in the comment section. Hi.
Yeah, she's talking about a soft tissue sarcoma as well, and chronic renal failure, and vets prescribe vincristine.
So will it have side effects on the kidneys? What do you guys suggest?
I haven't specifically heard of that medication. I can definitely do some research on it, and then if you want to email me directly, I can communicate with you like that. But a good thing to do if your animal already is in renal failure or has kidney disease, when on any medication, ideally take a renal supplement with it. So a specific one I know would be like a Venti kidney care. That's something you could take with it to try and protect the kidney as much as possible.
Amarpreet, have you heard of that?
Yeah, so vincristine, I was trying to search more about it. That is what I discussed earlier as well, that the side effects are kind of overshadowed. We generally don't know how it is affecting, but if it's already a case of chronic renal failure, kidneys function, we do know, is to detoxify body. So if it's already compensated, the body will have to do more effort to kick the byproducts of vincristine out. So it will be a good idea, as Ajay said, to discuss with the doctor, and if you get a supplement side by side, so as to give extra support to kidney. Yeah, is it oral you're giving? Is it orally, or it has been? I know there are drugs here, vincristine are given orally as well, but is it through intravenous they are injecting the drug? Prapti? IV, okay. Yeah, so you have to discuss with the doctor, because the option of kidney supplement is not at all bad. But again, because it's somebody else's practice and treatment, you have to discuss that with detail to them, what they recommend. But seeing the chronic renal failure and the body is kind of already in stress, I would definitely consider an external support to support the kidney system, for sure.
Okay,
I just wanted to
guys.
ask one more thing. Sorry, Nav.
No, that's
Since
okay.
we're on this topic of chronic renal failure, it kind of worries me a little bit, because when my dog was about 1.5 years, he'd gotten a surgery done, and he deliberately did it, overdosed on his pain medication. So he ate all 5 of them, and I had to rush him to the hospital. I had to get it pumped out of his system. And one of the things I was told by the emergency vet is, these kind of pain medications can eventually lead to kidney failure, renal failure. Maybe even when the dog is getting older, it's hard to say what kind of long-term effect that could have had. Now, the medication hadn't stayed in his system for that long. Like, I caught it pretty fast and acted really fast. But my question is, he's 7. He seems perfectly fine to me. Like, his diet is very healthy. In fact, he looks a lot younger than his age. But what would some signs look like when we're looking for chronic renal failure? And what should the course of action? My course of action be if that is the case? And also, is there anything I can do, like testing wise, or to keep track of, to make sure that that doesn't happen in this case?
So does he already currently have kidney issues?
Not that I'm aware of. No, he seems fine. His blood work is fine. Everything's been fine.
Okay, so then my recommendation would be to stick with your annual exams. He is 7, I believe you said, right? So yes. It is older in dogs, so it's recommended to at least do that blood work annually. I see big dog. But yeah, so should that happen, you'll most likely see lethargy, unwillingness to eat, weight loss, and shoot, I'm trying to think of a certain word.
Vomiting.
Yeah, there you go. Vomiting, and then dehydration. That's the word I'm looking for. Okay. But should you notice that does happen, definitely go get him checked up for. You could just do kidney value, so creatinine and stuff like that. It's definitely a lot less expensive than doing a full blood work profile. Should he come back with kidney issues, then your first thing would ideally be to change his diet. So you could put him on a low protein diet, such as, I only really know veterinary specific ones, so those are all vet certified, so I'm familiar with those. Specifically from Royal Canin, you could use a renal diet. There's like A, P, and S. Each one just stands for a different flavor. Or the prescription diet, you can put them on a product called KD. And then also starting the kidney supplements as well.
Okay, so there are ways to manage that and control that, and I'm assuming that it does lead to longevity in their lives as well, right?
Yeah, so I mean, basically the food, it has lower protein, so the likelihood of more damage occurring to the kidneys from the higher protein in food, that's already decreased. Another thing that you can also do as well is increase his water intake, but then also providing those kidney supplements that it'll kind of shield the kidney a bit in a way, to basically prevent longevity.
Okay, thank you. Nav, the floor is yours.
Sorry, I got Biba wanted to be center of attention. Any other questions before we end the session? Okay, so I guess not. So I want to thank Amar and Ajay for taking the time out to do another webinar with us. This was really, really kind of you, and it was very informative. We're hoping that we can do more of these webinars on other issues or concerns. You guys can email us at info@cavas.ntv.org with some of the topics that you guys think would be interesting for us to discuss. You can DM us on Instagram. I can't talk today. And then it'd be nice to see if there's anything else that people might be wondering about or thinking about, and they might not have information on, even if it's just general pet care, and more to know about stray dogs. Of course, we work with strays. So yeah, that'd be great. So anything you guys want to say before we end the session, Ajay and Amar? Any last words?
No, not really from my end. That's pretty much it. You pretty much covered everything.
Okay.
I would just say thank you so much for everybody who came here. And yeah, for all the pets around and for the animals, we are co-surviving. So make sure we respect each other's space, because they also need their space. Now we are sitting home with them, so we kind of, with our microscope, we go near them and everything is now exaggerated. So make sure that their natural healing powers are very strong. So providing them space when they're healing is very important. And we don't suffocate with them I know our intention is love, but that doesn't mean we have to suffocate them. So just this space.
I'm guilty of that. Yes.
I have experienced that as well. So I'm just speaking out of experience that just respect the space. Yeah. And yeah, the love is always unconditional. So
exactly. All right. Thank you so much, guys. And that's it for our session today on pet cancer awareness. Hope you guys have a good rest of the day.
All right, take care.
Okay. Bye, guys.
Take care, everyone.
Bye.
Bye.